Hi, I'm Lisa Brandenburg, Chief Health System Officer here at UW-Medicine. And we started a new fiscal year this July, and I just wanted to take a few minutes to tell you how we did last year and what's coming up this year. So what happened in 2019 and where are we going now? We're really on a journey. And in 2018, we started our foundational work with FIT, Financial Improvement and Transformation, and we got ourselves organized. We got a lot of things done. But in 2019, we really took off. We made significant progress with FIT, and I'm going to tell you a little bit more about that. But that includes expanding our clinical services, starting our work on patient access, getting increased funding from the state, and really starting to chart out our 5-year clinical strategic plan. So another key highlight this year is we expanded into South Lake Union. And this is a booming area, so it's really exciting that we're there now and able to provide care to patients. So in January, we started with the Retina Center, and we've seen over 3,000 patients in this location. In July, we opened our 15th neighborhood clinic location, and we've seen over 1,100 patients since July, and about a third are new to our system entirely. We also opened the Diabetes Care Institute there in beautiful space, and the patients love it. We've added some efficiencies like self-rooming, which turns out the patients and the staff both love. So this is very exciting news for us. So we're in a very competitive market in healthcare. And so it's really important that we create a really explicit clinical strategic plan for what we're going to do in what time frame and what are our priorities. And we're about halfway through this work. I'm excited about this. We plan to finish in late fall. And I'd like everyone to actually look for a Huddle article coming up in the next couple of weeks where we're going to be asking for some additional input. There's some good news from this year's legislative session for UW-Medicine. We had some significant outcomes for our system. And so we received funding, additional funding for both our patient safety net mission at UW-MC and Harborview, and capital funds to help us design a new 150-bed behavioral health teaching facility, as well as additional dollars for a health sciences building to improve our training facilities. And there's more funds we received, for example, for behavioral health telemedicine and resident and fellow training programs, among others. And I want to thank everyone who helped us advocate for those funds and let you know we're not done. We're going to continue to ask for additional funds to help with our safety net mission. We have some great news and progress on our initiatives. And so there's a lot of detail, and I'd like to ask you to look at the slideshow that we've attached if you want to hear more. But a couple things I'd call out to talk about. Clinical services. We're growing and expanding our clinical services. We have over 30 initiatives in this area, and we're hitting our targets in about 80% of those areas. And what's helping with that? Our patient access work. So many of you have seen some of the videos and emails that I send out about access. I'm passionate about that. It's critical we make it easy for the people who need to see us to get in and see us and make it easy for them. So I'm happy to say there's 10 pilot areas that we're doing work. We've gone live already in the first 4 plus the contact center. And we know now we have 57 clinics and over 400 providers using some of the new scheduling models. We've had some issues with the contact center over the summer, but we're making some improvements and continuing to see improved service. Also, we're making it easier for patients to schedule to see us. And we know patients want to be able to get in, see us, do things online, do things via text, and we're moving that direction. So we are rolling out more and more online scheduling, and we're also making it easy for patients to cancel their appointments by texting us. We're also investing in our infrastructure, making some critical investments for us. And one of those projects is the integration of Northwest Hospital and UW-MC. This is going to allow us to grow our programs more using the Northwest campus and UW-MC to make it easier to access our patients and give us a broader reach in the North End community. So that's very exciting. That will happen January 1, 2020. A second big infrastructure project for us is the D1 project. This is single electronic health record across our system. This work will help us become a system. And our clinician-driven committees are making decisions every day about how we're going to make improvements, about how we do that work, with some of the goals being decreasing the time we spend documenting for physicians and clinicians at the front line, and giving patients a single patient bill. We're very excited about this work. This will go live in October 2020. Well, I'm happy to report that FIT is working, and that's thanks to all of you and the work that everyone's doing across this organization. But you can see from our graph that we actually have moved from negative bottom line that we've had for a couple years to a positive last year of about a little bit better than break even, and this year running about a 1.1% margin across our system. We beat our budget this year by about $40 million, but it is still a 1% margin, which is not enough for us to stop. So we will need to continue. Our peers run about 3 to 5% margin in academic health systems across the country. That's the amount we need to make so that we can continue to invest in our people and our programs, which is highly important. But for next year, our goal is relatively modest. It's about a 0.5% margin. Why is that lower? Well, that's because we're making some big investments. I just talked about D1. There's a lot of one-time dollars in the D1 project, and I talked about the Northwest Hospital integration. Again, a project that's costing us some money, but I'd say short-term pain for long-term gain, both of these projects. These are critical for our future success. I just want to thank everyone for all of their hard work this year. This is paying off, it's working, it's been a big lift, and we are making progress. The work we do in this region is truly unique, and I want to thank everyone in this entire system for the work that they do every day. And I want to ask for your continued partnership and support on the initiatives that we're going to be doing this year. And with your help, we will be able to continue investing in our people, our programs, and our incredible mission. So thank you.